Welcome once again to Health Watch, presented by Novant Health. I'm your host, June Baker. Our show features local physicians and health professionals discussing health topics of importance to local residents. Today, Dr. Richard Scallion of Brunswick Surgical Associates will join us to discuss a procedure known as stereotactic breast biopsy. Then we will meet with Tiffany Lewis, a physician assistant who recently joined Oceanside Family Medicine and Convenient Care. And finally, Marty Goff, a volunteer at Brunswick Novant Medical Center, and she'll join us to share information about a special project in the hospital. Stay tuned to learn about valuable health topics with Health Watch. Dr. Scallion, thank you so much for coming today. It's a pleasure to have you. It's been a little while since you've been on the show.
Well, thanks for having me.
You're quite welcome. There may be viewers out there who missed the last episode, who haven't met you yet. So tell us a little bit about Brunswick Surgical Associates.
Well, there's 3 surgeons in our group. We're all general surgeons, and I've been there for 5.5 years, and we offer a wide variety of general surgery procedures as well as some vascular work, and I have one partner that does colonoscopies.
Who are your 2 partners?
Mark Tillotson and Rich DeSandre.
And you say you've been at the practice for how many years?
I've been there for 5.5 years. I actually trained up in Wilmington at New Hanover.
Oh, did you?
I did. And I finished training there in 1997. Then I practiced in Memphis, Tennessee for 10 years, then came here at the beginning of 2007.
And where did you go to medical school?
I grew up in Georgia, so ended up going to the State School at Medical College of Georgia.
Great school.
I thought it was.
Yeah. Do you have a particular specialty? What specialties do you focus on personally?
Well, of course, my specialty is general surgery. But,
right, but that encompasses a lot. But do you have a particular area of interest?
I would, if I had to pick a certain area, I would say laparoscopy. I especially like doing laparoscopic hernia.
Yeah, I hear you're really good at that.
Hernia repairs, but we can do gallbladder surgery laparoscopically. We can remove spleens. We can fix hiatal hernias.
So there's a lot of things now that you can do laparoscopically that we couldn't in the past, or and it was a much longer recovery and things like that. So
right, yeah.
Laparoscopic seems to be the way to go.
Whenever it's feasible. I mean, certainly sometimes it's still better to do making an incision the old-fashioned way, but when possible, there are definite advantages to doing the surgery laparoscopically. For example, gallbladder is probably the biggest benefit. I mean,
well, that used to be a really big scar.
Right, and it amazes me when I look at some of my older patients who have the big scar, and I almost feel sorry for them.
Yeah, and now it's just three or
four little incisions, and they're home a couple hours later.
Wow, that's amazing.
Yep.
Now, I think you have a couple of offices, is that correct? Where are those offices?
Our main office is in Supply.
It was next to the old hospital,
It's next to the old hospital, but hopefully around November or December, we'll be opening a new office next to the new hospital.
Wow, that sounds awesome.
Yes, the date we were told is November, but I suspect it may run a little bit later than that.
So, and it'll be right next to the hospital?
Right next to the hospital.
Well, how convenient for you to run back and forth, right, between surgery and...
Which I do all day long, every day. So
but now you have to drive.
Right now it's a little less than ideal. And we also have a second office in the Sunset Beach, Calabash area.
Oh, well, that's convenient for the southern end of the county, then. They don't have to come all the way up to Supply.
Correct. And both Dr. Tillotson and Dr. DeSandre cover that office.
Well, I'd like to focus our interview today on a procedure at the hospital called stereotactic breast biopsy. Can you tell me what that is so I'll understand it?
Well, traditionally, breast biopsies were performed in the operating room by making an incision right over either the breast lump or the suspicious area. And we've tried to get away from that. And most biopsies now are done with a needle. And the stereotactic biopsy, to be specific, is done with a needle that's inserted directly into the breast under guidance of a computer and X-ray. So the breast is placed into compression.
Kind of like a mammogram
Yes,
kind of thing?
almost like a mammogram. So it's almost like doing a biopsy in the middle of a mammogram.
Oh.
And there's a lot of advantage to that. There's essentially no scar. The diagnostic accuracy is at least as good, if not better, than the surgical technique. Oh. And then if, unfortunately, it does reveal a cancer diagnosis, it greatly enhances your ability to prepare for the eventual surgery.
Mm-hmm. So would you have your results quicker by doing it that way?
Well,
but at least you could visualize it. You'd be able to see the breast area in its entirety and see if there's other things in there going on.
Well, we already have that information based on the mammogram and the ultrasound before, so we pretty much know everything that's going on in the breast. We're just really focusing in on that one area. But the biopsy, once it's done, it takes about 2 days to get the results.
Well, are there particular patients that this procedure would be best for?
Yes, the ideal patient is a woman who undergoes a routine mammogram, and there's some suspicious microcalcifications, and so there's no lump, nothing that can be felt, just these microcalcifications, and those are most easily biopsied in the manner that I just described.
So a woman wouldn't even have to feel a lump. There may be those microcalcifications, and you can't even palpate those, but...
Correct. I would say at least half the patients I biopsy don't even have a lump.
Really?
They're masses that are picked up, or the calcifications that are picked up on mammogram or ultrasound.
So it's very important for us to have those mammograms.
It is, absolutely.
Because even if we don't feel a lump, there could be something there.
Correct.
Oh, wow. Well, how long does this process take?
So the entire process takes right about an hour as far as
that's not bad.
Getting the patient into the biopsy room, getting the patient set up, and then after the biopsy, getting the patient out of the room. But as far as the actual biopsy, it can be as little as 5 minutes. So from the actual time when the needle is inserted until it's finished, it could be 3 to 5 minutes.
And it's done in a procedure room in the hospital, correct? There's a room specifically set up for...
Correct. So the patients at our hospital, they come in through the surgery area and wait with the rest of the surgery patients, and then it's done in the ambulatory surgery area in a procedure room, and it's very nice.
Are there any risks to this procedure?
I think any procedure has risks.
Sure.
They're fairly minimal. If there was a risk, it would be bleeding after the procedure. But
that's not very common, is it?
It's very rare. I've had one patient that had bleeding in probably 10 years.
Wow. Is there any anesthesia or pain control during this?
Some patients, if they feel like they're going to be real anxious about the procedure, I can give them some Valium. I'll give them a prescription, and they take it about an hour before the procedure. And then during the procedure, I will use a local anesthetic.
And you said there are some times that this might not be appropriate for someone if they have a breast lump. What other options would be available for the lump?
So lumps probably can be biopsied with a different method that would be a little simpler. We have an ultrasound machine in our office, and most lumps, if they're suspicious, they can be visualized with an ultrasound machine. And then with a similar type of needle, it's a fairly large needle, I simply will insert the needle under guidance of an ultrasound machine and do the biopsy that way.
Well, that's been really great information. And if there are viewers out there who have questions or would like additional information, how might they get that? Could they call your office and speak with someone there?
Sure. You can call our office. The number is 575-4606, and Maria is our office manager.
And she'd be glad to field those questions for you?
Yes, or at least get the patient
to the right place. Great.
Yes.
Well, that's wonderful. Well, thank you so much for being here again today. It's been such a pleasure, and we hope to have you back real soon.
Thank you very much.
You're welcome.
Appreciate it.
Welcome, Tiffany. It's such a pleasure to have you here today.
Thank you, June.
I understand that you recently joined Oceanside Family Medicine and Convenient Care, and I'm curious what brought you to that practice.
Well, June, I'm originally from Brunswick County, so I wanted to come back closer to home. I have been working out, I don't know, couple of hours away, and wanted to kind of get back to my family and friends here. And in searching, in my search, I stumbled upon Oceanside Family Medicine and Convenient Care, and
It just worked out for you.
Sure, yeah. It just kind of everything fell into place. I'd been looking for about 6 months, and when I came upon that practice and in speaking with Dr. Eisenhower there, it just seemed real promising, and it looked.
There was great opportunity for
absolutely.
you there. Yeah. Well, let's talk a little bit about your education, your background. Now, I know you said you were from the area.
I am.
So I assume you went to one of the local high schools?
Oh, yeah, well, that's Cougar Pride,
June. Well, let's talk a little bit about that. How did you get started, and what made you want to become a physician assistant?
Okay, so that's a pretty long story, but I'll sum it all up.
That's okay.
I went to South Brunswick High School, as I've said. Go Cougars! And from there, I did my undergrad at UNC Wilmington.
Great.
And then from there, I graduated there in 2003 and went on to Wake Forest for medical technology.
Excellent school.
Yeah, it was wonderful. Winston-Salem's a great place too.
Yeah.
It's a beautiful place. But I came back and worked at New Hanover Regional Medical Center in the laboratory there for 4 years.
Wow.
And then finally pursued my educational career as a physician assistant at Duke. And then
wow, that's a great school.
Yeah, and it was a lot of fun. It was very challenging, but fun. It was great.
Did you always know that you wanted to work in healthcare?
Yes.
Really?
I grew up, okay, so on a more personal level, I grew up with, my grandfather was a quadriplegic.
Oh.
And so always, ever since I was a little girl, I helped him and spent a lot of time with him growing up. And I always told my mom, I was like, Mom, I want to help people just like Granddaddy when I get older. And so, yeah, it sure was. And
that's interesting.
Yeah.
Oh. Well, it looks like you found a great home.
Yeah, my home, my real home.
Your real home. And so you said you decided to join Oceanside because it was more the kind of practice you were looking for.
Right.
And so I know there are quite a few practitioners there. Let's talk a little bit about them. Now, I know Dr. Eisenhower's there, and he's the lead physician in that group. Is that correct?
That is correct.
And who else is there?
There's also Dr. Thompson, Dr. Pritz, Marie Wheatley, and John Fillmore.
Now, Marie and John are both, Marie's a nurse practitioner?
Yep.
And John is?
He's also a nurse practitioner, so the three of us are mid-level providers. And so it works out really well. And it is a busy practice, as you've already said.
Yeah. Let's talk about the convenient care piece. Kind of explain that to me.
The convenient care is basically an extended care clinic. It's a walk-in clinic.
Oh, it is walk-in.
It is walk-in, so no appointments really for the convenient care. But it's for folks who in the community who may need after-hours care or even weekends. We're open on the weekends.
So even though they may have an internist or a family practice physician in the area, and if it's after hours, then they can utilize the convenient care.
Absolutely.
And then go back to their family physician
Absolutely.
after that. And then what about records? Would those records then be, would the internists that they normally go to have access to their records?
Well,
they
certainly.
can call and get all those?
They certainly should, yes. They can, and a lot of times when I see a patient in the convenient care, June, I will provide them with an after-visit summary that they can take with them, and so they can keep it for their records or have it for their visit with their next provider.
Yeah, I think that continuity of care is very important.
Absolutely.
Now, that's great. Also, I wanted to ask you to explain to me a little bit about the term family medicine practice. What's the difference between family medicine and internal medicine?
Well, June, family medicine is a medical specialty that is basically devoted to the comprehensive health care of all ages.
All ages.
All ages, and it actually is for, we do lots of things in management of acute illnesses, chronic management, whether that be hypertension, diabetes, cholesterol, chronic illnesses,
Right.
as well as providing health risk assessments, immunizations.
So a lot of well visits
Absolutely.
stuff, a lot of wellness.
Absolutely.
And so I guess family medicine is you take care of the whole family. You can take care of
Right.
mom, dad, grandma, the new baby.
That's
everybody.
exactly right.
Everybody.
That's exactly
Well, that
right.
makes it real convenient. It also gives you an opportunity to get to know your patients and the whole family.
Oh, sure. Yeah, on a more personal level, it's great. And so, then family background, family history, and that helps a lot when you're looking at chronic illnesses and trying to manage those chronic illnesses within the family.
Do you do some sort of procedures at the clinic also? I mean, are there some sort of minor surgical procedures that you do?
We do. There are a lot of procedures that are offered, including minor dermatologic biopsies for suspicious lesions that may need to be biopsied. We do minor laceration repairs. We do just a broad array of simple procedures, abscesses and that type of thing. I don't know how specific you want me to be, but there are quite a few.
Well, it sounds like you do quite a bit.
Yes.
I mean, it sounds like that the patient wouldn't have to be referred anywhere else for
No, and
any
another
minor
good
things like that.
Another good thing about the practice is they offer in-house X-ray,
That's
ultrasound, and lab.
Oh, that's great to know. Yeah, that's great to know. Well, are you currently accepting new patients?
I am.
How wonderful, because I
Yes.
know there's lots of folks out there who do not have primary care, and to have another provider in the area is a great plus for Brunswick County.
Yeah, I don't know if you know, Brunswick County is considered an underserved community for the medical population, and so that just kind of goes back to coming back to my home to kind of give back.
Oh, that's great.
To give back to
That's a great philosophy.
the community where I live, and I've grown up here, and they are medically underserved, so it was good to come home.
Well, if our viewers out there would like to make an appointment, how might they do that?
Sure, that's a good question. Our phone number there is 754-910-754-4441, and you just that'll be the
Is
receptionist.
that the receptionist?
Yeah.
And they can just make an appointment by calling that number and asking to make an appointment with you or
Sure.
one of the other providers.
That's right.
Great. Well, it has been a pleasure meeting you, Tiffany. I'm so happy that you were here today.
Thank you.
And I hope to talk to you at a later date after you've had some experience and have something you want to share with us. We'd love to have you back.
Thanks, June.
Thanks
Thanks for having me.
You're welcome. Marty, welcome to the show. It's such a pleasure to have you here today.
Thank you, June. It's my pleasure to be here. I'm so proud of the volunteers at Brunswick, and I love to talk about them.
Well, great. Well, first, I want to know how long you've been a volunteer at Brunswick Novant Medical Center.
Since 2008, my husband passed away, and when my oldest son was leaving for his home, he said, "Mom, you can't sit in this house."
Yeah.
And being an old retired nurse,
Oh, wow.
I was comfortable in the hospital.
Sure.
So that's how I started.
Sure. Perfect fit then.
Yes.
Great. Now, I hear that you are chair of the Volunteer Council, and I'm not sure what that is. What all does that entail?
Well, we're kind of the governing body,
Oh.
if you'd like to call it that.
Uh-huh.
We have a historian, a financial liaison between the volunteers and Novant, and we have a secretary who sends out all of our cards and all, and that's basically what the council involves.
So it sort of governs the whole program along with the director?
With Deborah, yes. We're sort of the backup to Deborah.
Well, that sounds interesting. And how long have you been on the council?
For 2 years.
Wow. Well, I'm curious, do you know approximately how many volunteers there are at the hospital?
Well, when we moved last July from the old hospital to the new one, we had 60 volunteers.
60?
Now we have over 126 volunteers and are adding new ones just about every week.
So you've doubled in size since you moved into the new facility.
We have indeed. And this past year, 2011, we helped Brunswick with 18,000 hours of volunteer service.
Oh, so yeah, I thought I remembered that you'd calculate those hours and keep track of those.
Yes,
Is that
we do.
correct?
Mm-hmm. Yeah.
Wow.
Yeah.
How many hours have you put in?
About 1,200.
Wow.
Yeah.
That's a lot. Wow.
Keeps me out of trouble.
Well, I know there are a lot of you because when I'm in the facility, I see a lot of the pink jackets running around, and it seems like there's quite a few of you there, but all of you seem very busy now.
Well, it's amazing. We are now, with the larger hospital, we are all over the hospital and doing anything that we can to support the staff, from folding towels in central supply to transporting patients.
Well, now that you've mentioned that, what is your role at the hospital?
I work in ACU, which
And that is what?
Ambulatory care unit. That's where most folks go when they are admitted for surgery, whether it's outpatient or in-house.
Oh, really?
And I take the charts and put them in the folders for the next day surgery.
Oh, I bet that's an interesting job.
It is, and I love being back with the girls.
Now, I understand that you were a nurse in the past. Is that correct? So this is probably like deja vu for you.
Well, I used to say that I was an old nurse, and I was corrected.
Oh, no, you wasn't.
And they corrected me by saying I was an experienced nurse.
That's right.
Yes.
So it's like coming home for you.
It was. It was. I just, the hospital is a setting where I'm most comfortable.
Well, I know that the volunteers are a huge help to the patients and the staff at the hospital. And but specifically, I invited you here today to talk about a project that I believe you're very involved in, and it's called the Compassionate Clothes Closet. And I would love to learn more about that. I'm not familiar with that.
Well, it started out as a little help for a patient. We had a lady who was admitted for after a fall and had a hip replaced. And she was to be discharged to a rehab center, but she didn't have any clothing. And she was terribly upset over this and really didn't want to leave the hospital. So Deborah Rochelle, our director, scurried around and found some clothing for her to be discharged in. And that was the impetus that we needed to look at this a little closer. A lot of patients that come into the hospital have their clothing removed for various and sundry reasons. They are bloody, they're sick, some have been cut off of them. So we decided that it would be great if we could give them a little comfort and dignity when they were discharged. And we started at the old hospital with 2 plastic bins. And we now have our own closet.
You do?
We do. We're not outfitting people in the latest fashion, but we're trying to give them a little dignity when they leave by providing, T-shirts, pull-ups,
Trousers,
flip-flops, underwear, whatever they need.
Well, where does this clothing come from?
Donations mainly, but we also have a budget. We buy most of the underwear.
Sure, that's great.
But the other clothing, scrubs and whatever, we frequent the thrift shops, and some of our local businesses have provided us with gift cards so that we can buy things that we really need.
So you have a variety of sizes and clothing,
Yes.
and it's all clean and fresh,
Yes.
and so you can provide those to any type of patient who's being
Yes.
discharged.
It's not necessarily for the emergency department's patients, but also our social workers often need clothing for some of their patients. So we're generous. We let everybody have some.
So they're really available for any patient
Yes.
need then?
Yes.
And how do you collect the clothing? You said through donations. Does someone take charge of that? Or?
We have a committee
I see.
that makes sure that the closet is outfitted with underwear, flip-flops, whatever. And we have community members that bring in donations, and then the volunteers do also. We also have quilts that we give to our babies, and hats that our home volunteers knit for all of our little babies.
All
that
the
are
little
born
newborns get little hats?
Yes.
Oh, and you say you have home volunteers that
We
do that?
do. We have a very large number of home volunteers that make little bears that we give to children. They do the knitting of the little hats and the quilts, and we're very, very proud of them. Appreciate their service.
Those would be volunteers who maybe can't get out of the house or
They
don't have
can't get
transportation?
out of the house, or they don't have the time. Maybe they work, but they do want to be, a presence in the community.
Oh, what are the most used items?
Underwear.
Really? Yeah.
We are constantly running back and forth to supplement the closet.
How do the patients react to this service?
They are very appreciative.
There.
Before, they were going home wrapped in a blanket,
Right.
or paper scrubs, or barefooted, and so they appreciate having, and also to know that somebody in the hospital cares, that
That's
they're going
great.
home in a decent manner.
Did I hear that you won an award for this project?
We certainly did. We are still proud. The North Carolina Hospital Volunteers present a special award, project award, once a year. And this past year, in September, we were in Greensboro for the convention, and Brunswick was one of 2 volunteer groups that won special awards.
Well, that's something to be very proud of. I'm
was.
sure that you all are just
Yes.
still beaming from that.
Yes.
It just is a great attribute and a great tribute to the work that you all do. And I know that Brunswick is happy to have you there. If anybody out there is interested in volunteering, how might they do that?
There are a number of ways. They can call Deborah Rochelle, who is our Director of Volunteers, or they can stop by the hospital at the main desk and pick up an application. It's quite a lengthy process, which a lot of people don't realize. But we have to make sure that the job fits the person.
Right, right. Well, I am so happy to have you here today. It was such a pleasure, and what a great initiative the Closed Closet is. Thank you so much for coming, and I look forward to having you back the next time you win an award.
Well, we're working on that.
Okay, great.
Thank you, June.
You're welcome. Thank you for tuning in to ATMC TV's Health Watch. I hope this information was beneficial for you and your family. If you have any questions or topics that you would like to see discussed on a future show, please email them to atmctv@atmc.coop. I'd also like to encourage you to visit Brunswick Novant Medical Center's website at brunswicknovant.org for more information on the hospital, local doctors, and a comprehensive health library. Thank you again for joining us today. Be sure to join us next time for Health Watch on ATMC TV.